Greetings viewers. We have put in much effort, research and resources to create this video. If you would like to see more content like this, please consider subscribing to our channel. We would appreciate your opinion in the comments section following each video, and look forward to hearing your thoughts. Today we will explore whether kidney and liver transplants are possible. We will investigate if these organs can be successfully transferred from one person to another. Yes, it is possible to transplant both the kidney and liver simultaneously. This is known as a simultaneous kidney-liver transplant, SKLT, or a multivisceral transplant. A simultaneous kidney-liver transplant is a complex surgical procedure that involves the replacement of both the diseased kidney and liver with healthy ones from a deceased or living donor. The primary indication for a simultaneous kidney-liver transplant is the presence of end-stage renal disease, ESRD, and end-stage liver disease, ESLD, in the same patient. End-stage renal disease, ESRD, is a severe form of chronic kidney disease, CKD, that requires a kidney transplant or dialysis to survive. End-stage liver disease, ESLD, is a severe form of liver disease that requires a liver transplant to survive. Patients who have ESRD and ESLD are at a high risk of complications and death. In such cases, a simultaneous kidney-liver transplant is considered as it offers several advantages over a single-organ transplant. A simultaneous kidney-liver transplant can improve the patient's quality of life, increase the patient's chances of survival, and reduce the need for multiple surgeries. The surgical procedure of a simultaneous kidney-liver transplant is a complex procedure that requires a team of experienced surgeons, anesthesiologists, and other healthcare professionals. The surgery typically takes between 8 to 12 hours and is performed under general anesthesia. The first step in the procedure is to remove the diseased kidney and liver from the patient. The new kidney and liver are then placed in the patient's body, and the blood vessels and bile ducts are attached to the new organs. The patient's own blood vessels and bile ducts are then used to connect the new organs to the patient's body. After the surgery, the patient is closely monitored in the intensive care unit, ICU, for several days. The patient may need to stay in the hospital for several weeks to recover from the surgery. The recovery time varies for each patient, but most patients are able to return to their normal activities within a few months. There are some risks and complications associated with a simultaneous kidney-liver transplant. These include bleeding, infection, blood clots, organ rejection, and complications from anesthesia. The risk of complications is higher in patients who have other health conditions such as diabetes, heart disease, or lung disease. However, with advances in surgical techniques and immunosuppressive therapy, the success rate of simultaneous kidney-liver transplant has improved dramatically in recent years. The 5-year survival rate for simultaneous kidney-liver transplant is around 80% to 85%. In conclusion, a simultaneous kidney-liver transplant is a complex surgical procedure that is used to treat patients with end-stage renal disease, ESRD, and end-stage liver disease, ESLD, in the same patient. The procedure is a complex one and requires a team of experienced surgeons, anesthesiologists, and other healthcare professionals. The procedure has improved over the years and the success rate is high. However, as with any surgical procedure, there are risks and complications associated with it. What did you learn in this video? Please leave a comment below, and I will answer it. Also, Let me know what topic you would like us to cover in the next video.